Hello, guys. It's another day in Diabetes Awareness Month, and today I want to talk about how diabetes affects the skin. In the earlier video, I talked about diabetes and how it works. The body now goes to protein sources, protein from your muscles, from your hormones, from your immune level, from your skin, from your cells. Tries to break them down to create sugar. We call this gluconeogenesis, that is, creating sugar from non-sugar sources. The detriment of this is that skin is affected, the muscles are affected. So you have things like weight loss, unwanted weight loss, because the muscles have been broken down. The skin is thinner. Now, how does it affect the skin? Because diabetes is going on, the blood vessels are narrowed from deposit of fat. Nutrients doesn't easily get to the organ. Oxygen doesn't easily get to the organ. Organ now we're looking at is the skin. The nerves are damaged. So we have things like prickly sensation, we call it paresthesia. We have numbness, loss or reduction of sensation in the extremities, the fingers, foot, toes. And as a result of this person may not know when there's an injury. This person has a wound. Let's put that aside. Because the skin is now thinner from protein being used to create sugar by diabetes, the skin that's supposed to be a barrier cannot help protect against assault from outside. So there's infection, there's skin rash, there's easy bruising, and there's difficulty in healing. A wound that will take usually maybe 2 weeks or 1 week to heal will now take 3 weeks, a month, or longer because the skin has been damaged. The proteins needed to fix the skin have been used up by diabetes. And because of the close contact with blood, this bacteria gets into the system, high sugar, it thrives. Fungi, high sugar, it thrives and causes what you call sepsis. That is, this blood now has the bacteria inside and now transfers to all the body. That aside, now there's a wound. This wound cannot heal properly. This wound cannot close up properly because there's no enough nutrient from the blood, because there's no enough immunity to help prevent infection from spreading. And the collagen and all the other proteins necessary for closing up the wound are not available. So this wound becomes an ulcer. This ulcer can eat up the skin up to the level of the bone. We call something diabetic foot ulcer. The ulcer has been so bad that it's not healing anymore as a result of diabetes, poor skin, poor blood supply, blood nerve supply, poor healing mechanism. I hope with this, we'll be able to talk about diabetic foot ulcer and skin diseases. How do you prevent this? Constant foot care. Wear protective footwear that not too hard. Protect your foot from nails, from stubbing your toe, from glass. Look at your salt intake. Salt intake. I've noticed that in some people that consume a lot of salt, they have sweaty feet. Sweaty feet will cause a focus for bacteria to settle, and then infection starts. You also that wear flip flops that divide the toes. That place can be a friction area that narrows, that eats up the skin. Bacteria will set in. Wet feet, moisture, sweat can cause bacteria, and then foot ulcer results. Examine your feet. You may need to supplement your vitamins, all this in addition to dietary control, sugar control, use your medication. Thank you, everyone. I'll see you on the next one.